Administration nebulizer. A nebulizer changes medication from a liquid to a mist so you can inhale it into your lungs. Inhalational therapy may be administered through nebulizers that have a large or small volume, are connected to ventilator tubing, or are ultrasonic. Inline nebulizers are used to deliver medications to patients who are being mechanically ventilated. In such cases, the nebulizer is placed in the inspiratory side of the ventilatory circuit. Ultrasonic nebulizers are electrically driven and use high-frequency vibrations to break up surface water into particles. The resultant dense mist works to penetrate smaller airways and is useful for hydrating secretions. Aerosol administration of medication is used commonly in medical conditions of airflow obstruction, such as bronchospasm and airway hyperresponsiveness. Indications: presence of medical conditions associated with bronchospasm, asthma, chronic obstructive pulmonary disease, COPD, cystic fibrosis, bronchiectasis. Contraindications: none. Advantages: provides oxygen and aerosol therapy. Can be used for long-term therapy. Disadvantages: increases the risk of bacterial growth in reusable units. Increases the risk of overhydration by mist in infants. Equipment: pulse oximeter, peak flow meter, oxygen with tubing and nebulizer mask, aerosol administration kit, air compressor, 0.9% sodium chloride, 3 milliliters. Medication, commonly used. Stethoscope. Pressurized gas source. For ultrasonic nebulizer therapy. Ultrasonic gas delivery device. Nebulizer, couplet compartment. Prescribed bronchodilator. Prescribed medication for inhalation. Vital signs monitoring equipment. Suction source and supplies. Peak flow meter. Normal saline solution. Procedure: position the client in a comfortable upright position. Apply the pulse oximeter and monitor continuously throughout the procedure. Plug the air compressor in and open the aerosol administration kit. Insert the aerosol medication into the aerosol administration kit at an appropriate dosage and mixture. Procedure continued. Determine the best method of administration, mask versus mouthpiece. This depends on the age of the client and ability to handle the mouthpiece versus the mask. Turn on the machine, a fine mist should form. Instruct the client to breathe in until the mist disappears, then slowly exhale. Slow inhalation and exhalation should allow effective administration of medication with fewer side effects. Procedure continued. If possible, place the patient in a sitting or high Fowler position to encourage full lung expansion and promote aerosol dispersion. Adjust the flow according to the manufacturer's recommendations, usually 6 to 10 L/minute. Continue the treatment until all the medication is depleted. Auscultate the patient's lungs to evaluate the effectiveness of therapy. For inline nebulizer therapy. Insert the nebulizer cup adapter into the inspiratory limb of the ventilator circuit 6 inches, 15.2 centimeters, from the Y connection to create a reservoir of aerosolized medication in the inspiratory limb of the circuit and to reduce the amount of drug flushed into the expiratory limb. Remove the heat-moisture exchanger from the ventilator if it's attached. For ultrasonic nebulizer therapy. Fill the couplet compartment on the nebulizer with the prescribed medication or normal saline solution to the level indicated. If the dose to be inhaled is larger than the maximum capacity of the compartment, divide it into several separate inhalations. Turn on the nebulizer machine and check the outflow port to ensure proper misting. Encourage the patient to take slow, even breaths through his mouth. Completing the procedure. Dispose of used supplies in the appropriate receptacle. Remove and discard your gloves and any other personal protective equipment worn. Clean and disinfect your stethoscope using a disinfectant pad. Perform hand hygiene. Document the procedure. Special considerations. When using large volume nebulizer therapy in pediatric patients or patients with a delicate fluid balance, be alert for signs of overhydration. If a nebulizer device is for single patient use, use it only for a single patient. The fraction of inspired oxygen, FiO2, may be diluted if the flow isn't adequate, so if the mist disappears when the patient inhales, increase the gas flow.